Coming.
Provide privacy for your patient. Hello, my name is Michael Arduin. I'm a student from Nevada State College. Can you please say your date and name and date of birth for me, please?
Yes. Susan Smith, January 1st, 1960.
Alright, Miss Susan, let me just double check that on your wristband. That's good. Okay, the doctor ordered indwelling catheter for you today. Are you aware of that?
Yes.
Okay, have you ever had one before?
Yes.
Okay, so it shouldn't be painful, but if you feel any discomfort or pain, just let me know, okay?
Yes.
And I'll guide you through the whole process. Is that okay?
Yes.
All right. Let me just pull this up. Are you allergic to iodine or latex?
No.
That's good. So make sure that the bed is on the same level as you, where you can work comfortably. All right. And if you have extra blanket, when you take this off, make sure you put a blanket on for privacy and warmth for your patient. Alright, so now let me just take this off, okay? And if you have a blanket, just put a blanket on top of her. Alright. So please, if you can just flex your legs up for me, please. Make sure it's 2 feet apart. So just like this. So this is what we call the dorsal recumbent position. Make sure the patient's legs are flexed and the knees are and the legs are apart like this. And provide privacy while you're preparing your kit. Alright, that's good enough, Mr. Susan. So let me just go ahead and prepare my stuff. All right. Alright, so now you can open this. Make sure you open the part away from you. And just flap. And make sure you're close to your patient. You know what I'm saying?
Okay, so now that you're doing okay, I'm just gonna go ahead and
So this is also a sterile field. So make sure you're not contaminating anything. Okay. Make sure you have enough space to work with your patient. So right now, so now you can put this on her for her safety measure.
Oh, I thought you were gonna do it. I know, but I thought I forgot something. That's why you were like.
Can you please lift your
I wasn't sure.
box for me, please?
Okay.
Thank you. Just go like this.
I thought it was like because you.
And just hold this all the way in here without contaminating the field. That's good. Thank you. So now you can pull in your gloves.
I'm about to finish your
Yeah, we want to get this done so we can practice on the guys. The meal.
My attention, girl.
So 2 videos.
Now we're putting on the right gloves.
sorry.
So we're gonna have to
I wanted to do
extra stuff at the end. You're just like, okay.
so many things. Okay, I was gonna
Make sure you're not contaminating the gloves.
you were kind of like looking at me, and you're like, oh, did I forget something? So I was like, okay, we're done.
I was like, I was just waiting for you, and I was like, that's why I was like,
Did I forget this?
Make sure before you do this, the catheter, make sure that you assess your patient, check for discharge, check for any bleeding or any discomfort on abdominal area. and make sure that you've done a perineal care for her before the procedure. So this one goes up here. So you can go ahead, pull this up here. And make sure you're not contaminating your hand because you're wearing a sterile gloves already. That's good. And now you can go ahead and prepare your items. Before you start, make sure, it depends on your hospital policy. Make sure you check your balloon if it's working. And make sure you're not showing it to the patient. So get one. And just prepare this.
Oh yeah, just kidding. Put it on.
It looks like it's working. Okay. So now you can go ahead and put this here. Okay, just go ahead and prepare your stuff.
And go.
Knock, 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 knock.
Come in.
Hello. My name is Shelby.
And if your doctor ordered a
How are you today?
Good, how are you?
sterile
Thank you.
specimen sample, you can use this one.
Doctor has ordered the
Since he's not ordering that, you can just go ahead and
Yeah,
use it.
how excited are you?
Very, finally.
So now, go ahead and prepare your items. Prepare this.
Jane Smith, December 9th, 1990.
Okay.
And then, what you can do here,
So we're just gonna take out that
to avoid any mess, you can place this here, okay?
first. We just get some gloves.
That's good. So now you can bring this here without contaminating anything.
Okay. So basically what I'm gonna do is I just have to remove this
So,
tape off of your leg.
Miss Susan, it's gonna be a little cold once I put the
You might get a free
iodine. And please let me know if you feel like any pain or discomfort, okay? So make sure that you're holding this. Your non-dominant hand will be your non-sterile hand, and make sure that you're holding this part.
That was to keep it.
And make sure that you're
What
not
I'm gonna do is I'm just gonna kind of stick the catheter.
touching anything. All right. All right, Miss Susan, it's gonna be a little cold, okay? If you can just relax for me.
Pull that water out so that way we can just.
So just one side each.
Okay.
Usually, if this happens, like you always have 5 swab sticks. And you do one wipe from front to back
Kind of locks or something for the catheter.
on your labia minora and labia majora, and then one wipe from front to back again from the meatus down to vaginal. All right. So that's after that, and everything's good. So just, if you can just inhale for me, and maybe you can take happy thoughts, or just try to relax, okay? Just slow, deep breath.
Yes.
Okay, I'm going in now, so just bear down with me.
I'm just gonna get some new.
So make sure you have this, and go inside. And if you see the urine, add more, you can go in for 2 more inches to make sure that the balloon is inside, and you can inflate it. And now you can go ahead and put water in the balloon. Let me know if you're feeling any pain, okay? So that's good. And once it's in, you can go ahead and try it. Just put it slightly. Make sure the balloon's inside. So that's good. Thank you. How are you feeling?
Good so far.
Alright, so now you can go ahead and you can go put this here. It should be on the same level of her bladder, and there's usually a hook here. Some beds, they always have a hook. So just pull this out. And do not put this on the rail, because if it moves, the bag might get pulled also, or the catheter, and it will be painful for the patient. So just put it on the hook here on the bed. Make sure it's the same level as the bladder. And if there's urine, just make sure that you check for the volume, and check for the color, and the characters of the urine, okay? So after that, you can go ahead and put the strap on your patients.
10 ml out. I noticed on the catheter on the label it said that 15 FR and it had 10 ml in the balloon.
So hopefully, Miss Susan, we can take this off tomorrow or as early as we can, okay? We just need to monitor your urine, your input and output today. The doctor ordered that for you, okay? And if you have any pain or discomfort, just keep your call is right here, and you can give me a call, okay? You did really good on the procedure.
Thanks.
So make sure that you're putting this here first.
I just want to make sure not to do it in front of the patient, you know. Alright, I'm just going to unclip the bag.
Make sure you adjust it. Is that okay?
Make a note
It's not too tight.
in the bag. Alright,
Now you
so you're
can
doing
put this
okay, I
here.
don't see any bleeding. And are you feeling okay? Yeah, I'm okay. Alright,
And you can go ahead and just clean all your stuff here, and make sure that you take this off.
please let me know. I'm just going to go
And if there's any lubricant gel here, you can go ahead and clean it
out of the way.
off a clean towel, and just check for any discharge or any bleeding. And she mentioned that she doesn't have any pain, so that means it's good. And now you can go ahead and relax your legs for me, and then make sure you always provide privacy after, and make sure that everything is all in and the tube is not on the way of any rail or anything, and it's all clear. Just put this back here, and you monitor that is the urine throughout your shift. Make sure you check it make sure it's not too full before you dispose it. Okay. All right. Thank you, and put it back there. Blanket for Thank you so much, Miss Susan. You did really good. And please give me a call when you need anything. Okay. Thank you.
Yes.
And after you put on your the catheter to your patient, just make sure that you document everything, any abnormal findings or any significant information on the urine and catheter. Okay. Make sure you record your patient's reaction, and make sure that you put the bed down after the procedure.
So first thing you're going to do is go ahead and come in on my side.
I didn't tell you what to do. Oh my god.
Coming.
Hello, my name is Michael Argerun. I'm a student from West State College. I'm back. Just for hospital protocol, please say your name and date of birth for me, please.
Yes. Susan Smith,
All right, Miss-
1964.
Alright, Miss Susan, let me just double check down your wristband. That's correct. Alrighty. So let me just pull this up, okay? How are you feeling?
Good so far.
Okay, so the doctor ordered to take your catheter out now. So this shouldn't be as long as the first as putting it in, okay? And please let me know if you have any pain or discomfort when I'm taking it out, okay? Make sure you assess your patient for her any pain or any discharge in her vaginal area, okay? Are you having any pain right now, Miss Susan?
No.
Okay, that's good. So I'm gonna go, is it okay if I expose you?
Yeah.
Okay, just take this out for a sec. And if you have a blanket, extra blanket, just put it on top of her for her warmth and comfort, okay? So I'm gonna go ahead and lift your gown up, okay? Here we go. Alright, make sure you put on gloves. You can use clean gloves for this.
I don't know. I have mine gloves before.
So,
I feel like it would be easier.
And make sure you assess the
Hi, you're very young.
okay, I'll check the wristband.
And then just take a deep breath in for me and deep breath out, okay? If you feel any pain, please let me know. It's not supposed to hurt. You might feel some discomfort or some pressure. That should be normal, but if it's painful, let me know right away, okay?
So make sure you assess her vaginal area, check for any bleeding or discharge. All right. And if the chalk's wet, you can go ahead and take this off and put a new one. So it looks like, if you can just please lift your legs up for me like what we did last time, okay? Just make sure you lift your legs up. All right, and just make sure it's flexed, okay? And then the knees are down like that. That's perfect. Just lift your butt up for me, please. Thank you. And take this off. And just replace it with a new chunks. Alright. Lift your buttocks up for me again, please. Thank you. That's good. Alright. So now that you have that on, and then we can go ahead and take this off. Alright. And you need to use a sterile syringe for this to always deflate the balloon, take all the water out or the air out before you take the thing out, okay? So just go grab it like this and go ahead and make sure you know how much you put in. Well, I put in a 10 ml, so make sure you take 10 ml so it won't have any extra water. How you feeling, Miss Susan?
Okay, so far.
Alright, that's good. So now that this is out, and make sure you clean and make sure you do. I'm just gonna put clean gloves again, just in case I wanna. Give her any infection or anything. Alright, so I'm gonna have to pull this out and let me know. Please let me know if you feel any pain, okay? So please just slowly deep inhale and exhale for me. Just relax. Try to relax as much as you can, okay? So I'm gonna pull it now. So make sure when you pull it, just keep pulling it. And here you go, you're done. And once you're out this, you can take this off. Let's take this out. And you can go ahead and discard and make sure that you check for any discharge or anything. If you might have to send this to the lab if you have to, but it looks like it's good. And make sure you're not showing the patient. So you can go ahead and discharge this if you don't need it. So once you're done with that, you can go ahead and hand hygiene.
Velvet Chicks Lestrange 22766.
Alright, I'm just gonna double check your waist.
So Miss Susan, I'm just gonna clean your do a perineal care on you before I leave, okay? Just to make sure that there's no discharge or any secretion on your private, okay? So just make sure that you do this. Just one on each side again. If you have towel, you can use towel, but you can go ahead and just clean it. It might be a little cold, okay? So just clean it. And then you can go ahead and use the other side, just to make sure that you're wiping and no any lube or any discharge on her. Just the other side and just wipe this side. And after that, make sure that you're using the perineal care. That's good for your patient, okay? Maybe just one more on the side. Just make sure that you go. Alright? Now, Miss Susan, you can relax. You can put your feet down, okay?
Yes.
Alright. How are you feeling?
It's okay.
Alright. So from now on, if you're gonna use the restroom, and if you can go ahead and give me a call if you need assistance, okay? There's your call light right here.
Yes, thank you.
Thank you. I'm gonna put this up for you. And if you want, you can go ahead and assess your patient for everything. Make sure she's okay, her vital signs, her blood pressure. And to prevent fall, you always have to put your bed down after the procedure. Alright, Miss Susan, you did really good. So I will be right back, or give me a call when you need help, okay? Thank you so much. And now you can go ahead and discharge your stuff.
Yes, thanks.